Have you ever wondered how doctors diagnose serious conditions like cancer or liver disease? The answer often lies in a single, tiny sample of tissue known as a biopsy. In this video, we'll break down exactly what a biopsy is, how it's done, and why it's one of the most critical tools in modern medicine. From needle biopsies to surgical procedures, understanding this process could give you the clarity you need when facing a major health decision. Stay tuned to learn how this small test can make a big difference. A biopsy is a medical procedure in which a small sample of tissue is removed from the body for examination. The primary purpose of a biopsy is to diagnose diseases, particularly cancer, by analyzing the tissue sample under a microscope. The procedure helps doctors determine the presence, cause, and extent of a disease. It can be used to investigate abnormalities, which can be functional, such as kidney or liver problems, or structural, such as swelling in a particular organ. When the tissue sample is examined under the microscope, abnormal cells may be identified, which can help to diagnose a specific condition. If a condition has already been diagnosed, a biopsy can also be used to assess its severity, such as the degree of inflammation, and grade, such as the aggressiveness of a cancer. This information can be very useful when deciding on the most appropriate treatment. There are several types of biopsies, each suited for different situations and types of tissue. Needle biopsy. A needle is used to extract tissue or fluid. This category includes fine needle aspiration, which uses a thin needle, and core needle biopsy, which uses a slightly larger needle. Surgical biopsy. A surgeon removes a larger section of tissue. This can be an incisional biopsy, where a portion of the tissue is removed, or an excisional biopsy, where an entire lump or suspicious area is removed. Endoscopic biopsy. A flexible tube with a camera and tools, known as an endoscope, is used to view and collect tissue from inside the body. This can be from areas such as the gastrointestinal tract, bladder, or lungs. A punch biopsy. A sample of skin is removed using a scalpel, punch, or other instruments to diagnose skin conditions, including cancers and infections. Bone marrow biopsy. A sample of bone marrow, usually from the hip bone, is taken to diagnose blood-related conditions like leukemia or lymphoma. How a biopsy is carried out will depend on where the tissue sample is being taken from. Before the procedure takes place, a CT or MRI scan is often used as a guide to help in this decision-making process. Most biopsies will only require local anesthetic, which means you won't need to stay in hospital overnight. But an overnight stay is usually required when the procedure is carried out under general anesthetic. The majority of biopsies are painless once the anesthetic starts to work, although this depends on where the sample is being taken from. You may experience a dull ache, which can be treated with painkillers on the advice of your doctor or surgeon. Some types of biopsies may involve staying in hospital for a few hours. You may need to have stitches or a dressing applied before you leave. After the tissue sample is taken, it will be examined under a microscope to help identify the nature of the problem. This often means that a definite diagnosis can be made. We hope you found the information in this video useful.